We're at the Connection Summit at CTIA. This is Ken Pyle and VOD TV, and we're with Geeta Nayyar of AT&T, and you've got a really, really interesting title, one of the most interesting ones I've heard of, Chief Medical Information Officer. Did I get that right?
You got it right. It's a mouthful, but you got it right.
Okay. Well, tell us what that means.
Sure. Well, it means that I innovate every day, basically, with AT&T. So I've been with the company almost 2 years now. I'm a practicing physician, a rheumatologist by background, and essentially my role is to really bring a physician's perspective to our products and solutions as we look at the healthcare market. I still practice, love seeing patients, and kind of keep this bridge between practicing and seeing real-life medicine with technology and the power that can be released into the market.
Well, yeah, I just so love it when people are actually doing what they're talking about, and that's what it sounds like you're doing. And what are you seeing kind of as things evolve? What's the most important thing in this year that's impacting kind of how you improve healthcare?
Sure. So, I think one of the biggest changes that's happening in healthcare today is a real consumerism that hasn't really happened in the healthcare industry. I think we've seen it with a lot of other industries, which is great because we have a lot of lessons we can learn. But at the end of the day, I think patients are expecting a more transparent process. They're expecting a process that doesn't interfere in their lives. So what do I mean by that? I mean that they want to be mobile. They want to be mobile. They want to be able to access healthcare where they work, where they live, where they practice. And that's really what we're trying to achieve at AT&T, is really meeting the patient where they experience their healthcare and their disease state, and how to better bring the patient and the physician closer together, ironically through technology. I know people always think, oh, technology is so hands-off, but we're really trying to do it in a way that's meaningful, drives patient outcomes, and also makes the experience actually a lot better than it is today.
Well, it's funny you talk about learning lessons from other industries. The way you described it reminded me of video and video on demand.
Yeah, absolutely. Again, it's information is coming at people from every direction, right? And I believe that every person is a patient. So whether you're getting on video on demand, whether you're getting it from social media sites, whether you're getting it from the internet, or whether you're getting it from your neighbor, who better to get it from than your physician, right? So to the extent that we're enabling those conversations, helping them happen beyond just the four walls of the hospital or the four walls of a physician's office, that's really where patients, want to have these conversations and think of them, right? Because at the end of the day, there's only so many minutes you get with your doc every so months, and that's really a snapshot in time, and it's not enough, right, at the end of the day.
And as a physician, you can answer this question very well, but I mean, it must be frustrating. The part that you must really enjoy is the part working with the patients, right? There's a lot of other stuff kind of probably they have to do to kind of make that happen, but does this allow you to kind of get rid of some of that other stuff and have more patient interaction?
Definitely. In the average practice today, there's so much administrative burden, whether on the physician or the physician staff, that really get in the way of just spending that quality time with the patient and actually practicing medicine. It's ironic to say this, but it's actually much easier to make a diagnosis. I can make a diagnosis of diabetes, lupus, rheumatoid arthritis, you name it, in just a couple minutes if it's a straightforward case. But to actually bill the insurance, document the case, get the patient's care coordinated, much, much harder than actually practicing medicine, which is unfortunate, but again, a real opportunity.
And you see some of these technologies kind of enabling, kind of cutting some of that friction down?
Absolutely. With so much that's going on in medicine and the advancements in healthcare, we are able to essentially do laparoscopic surgeries, surgeries that require so much less invasion and less blood and infection and all these innovative things that medicine's known for. But on the back end, we're so stuck into paper systems, antiquated systems that actually make the delivery of healthcare that much more inefficient and less personal. I think we've all had stories of how either we've experienced healthcare or what someone in our family has, and it never seems to really be a positive experience. It always says, I had to wait too long, or they messed up my record, or it was the wrong, it was the wrong thing that was supposed to be delivered that day. And that's not the stuff that doctors go to medical school for, right? The medicine part is easy. It's this other jazz that we need help with, and I think that's where the technology really comes in.
From your perspective, what is kind of the top item there to kind of help help you in your role as a physician? Is it kind of this back end data that happens, or is it kind of on the consumer side at the connected home or the connected person? Where's the big bang for the buck?
Sure. I think that clinical medicine is actually a lot of fun. I mean, I love practicing. So many of my colleagues enjoy practicing. So I don't think we have to actually reinvent the practice of medicine. I think it's just about taking the way we practice and kind of shifting the way we do it to make it easier. So, for example, we think of doctors going, back in the day, going to patients' houses with that big black bag, right? No one does it anymore. But if I had the opportunity to actually have insights into what was going on with my patients when they left my office, maybe not with a big black bag, right, but through some sort of mobile device. Exactly. It's a virtual black bag, whether it's through remote patient monitoring, whether it's through mobile health technologies, whether it's through social media channels. There's just a real opportunity to, I think, engage with patients in a way that we've never done before in our practice. And maybe we did in an old paradigm where it was a small town family doc that knew the whole family. And I kind of like that idea. I mean, I think if technology can help us do that at scale, why not? Why not do that, especially in an era where we don't have enough physicians, we don't have enough specialists, and I believe we never will, right? There's always going to be patients that need access to a specialist or a physician, but they're out in rural America, or they're in the inner city, and there are all kinds of access issues. And so when you think about telehealth, remote patient monitoring, mobile health technologies, it's really expanding care to populations that don't otherwise get access. And even with just just run-of-the-mill patients who have chronic diseases, there's never enough time for follow-up, or there's always something that's not quite understood in terms of what's going on in the home setting that can really influence the way that you treat a patient as a physician, but without having that insight, you really don't know.
I would imagine it could allow you for more shorter visits than maybe the one long visit, right?
Definitely. I mean, the opportunity to collect data and information before a patient even walks into your office, or the opportunity to be able to really trend different data that otherwise is very difficult to do in a paper-based system, is absolutely meaningful. And I think that's what it is at the end of the day. It's not just about volumes of information, but it's actually about meaningful bits of information. So, for example, when I have a diabetic that comes into my office, invariably they come in with a piece of paper, a restaurant napkin, a paper towel, of all their different finger sticks and sugars from, I don't know, was it Monday? Oh, no, Dr. Nayyar, it was Wednesday. No, this is when I went out to dinner. And it's always this, confusing path of what actually are their sugars, what are their numbers. And I, as a physician, am only as good as the information given to me, right? So if my patient can't validly tell me where they're at, it's also very difficult for me then to prescribe a treatment regimen, right? So it just makes sense that if there was a way for a patient to capture this information while they were at home in an easy way that was accurate, or even more accurate than a paper system, it just makes me that much more informed and better able to help them, and them that much better informed to make better choices about their disease state.
So have you been able to implement some of these in your own practice as far as?
Sure. So we, in our practice, we have an electronic medical record that we've had for some time, and we are currently actually exploring some of the mobile technologies that are out there, and I'm definitely spearheading some of that, so I'm very excited about it.
That's great. So you're not only the CMIO, you are also the beta tester, it sounds like, for a lot of this stuff.
On some level, I guess so. I feel very privileged to be able to kind of straddle both worlds, but it's a lot of fun. And, the other thing is that when you're working with residents and medical students and doctors in training, they also just teach me so much. I mean, they always come in with the neatest and greatest application and the neatest and greatest idea as to how we can better engage with patients and better drive outcomes. And I think that's really where it's all headed for the future of medicine.
Well, super, Geeta. It's really great to hear what you're doing, your story, because it sounds like there's a lot of good stuff to come.
Definitely. Thank you, Ken. Thanks for having me.